So as far as prenatal care, it is really important for numerous reasons. One would be just for the mother's health, because even when I'm talking to some of my students, I'll talk to them about how when they're wanting to know what's going on with the baby, they need to know all about what happened with the mother because they're so intimately connected. So that would be about, let's say, nutrition or health. For instance, folic acid, they can have a neural tube defect, and just a simple thing of a mother taking a prenatal vitamin can help take away that risk. Another would be a heart condition. They get prenatal care, they can do an ultrasound and see what the heart's like and then have extra help ready at delivery. So numerous. This could be simple as when mothers get screening, they test something called GBS, so it's group B strep. And then if a mother gets 2 doses of antibiotics before they deliver, that risk is gone, as opposed to being afraid for that baby up to 6 months after delivery. So there are just numerous ways that getting prenatal care can really help the health of the baby. And then just one other thing that I think is so important would be maybe breastfeeding. And we have found, I used to work in a clinic where we had residents, and we were right next to the OB clinic. And so we would, after the moms had their appointment, they would come over to the pediatric side, and we talked to them about the benefits of breastfeeding. And the big thing is even just getting moms to decide before having the baby, because they can have lots of problems, hard, pain, and having education before you're in the situation helps moms to prepare, know what's normal instead of just giving up. So we found that to be very, very effective in just preparing moms so they know what they're going to enter. I think it's connected, whether that's even nutrition. A lot of it too is we find that there's a relationship between mothers caring, and so they get prenatal care, and then mothers who maybe had 2 or 3 visits before they had their baby, and there's a lot of relationship between that, even just in nurturing. So if we can get moms to care and take interest in their babies, they're more invested. An example is when we're doing our history and physical with a new baby, we'll say, have you had at least 12 visits and started before 8 weeks or around 8 weeks? And we call that the 8 by 12. And if we have, we automatically put them in a lower risk for having problems just because the mom was invested enough to go to prenatal care. So some of that is just even very relational. A big one too would even be, we always ask, do you have a name for your baby? And if they've been thinking ahead of time as they're pregnant, that's kind of seems like a stretch, but it's part of the prenatal care of like even investing in the name of your child. So, and then of course, alcohol, drugs, all of those, they've found research that has shown like more increased ADD and other problems with concentration and school development. Yes, and I think it would, because prenatal care is kind of a broad phrase of so many different things that get addressed, whether that's, their nutrition, their labs, what mothers are intaking. So, for example, they found if a mother drinks too much alcohol, then that can affect even, they have a whole syndrome, and then they do poor in school. And so if you're addressing something simple like that in their prenatal care, then we find that the kids do better. And again, some of this is really hard because it is so interconnected in so many things that are influencing them before they even have the baby, but especially how they do cognitively in school. When they're still pregnant, it is a balance. I would say the biggest one would be their nutrition. And even though I say that, there actually is, it's kind of neat because there's a research in Africa where some of the women weren't able to get enough nutrients in, and they could only eat off of the land, and they had very malnutrition, but their babies did fine. So even though it's so important, there's also this miracle that babies do well even if their moms may not have optimized their nutrition. Still, I would say that's the rarity. You know, a lot of it would be, the biggest thing, in my own opinion, would be probably breastfeeding. I feel like that's the way, if mothers can decide before they have their baby and then breastfeed, whether that's just protecting them from illness, it gives them more immunoglobulins to fight disease, even just the bond of having the baby at the breast, and that relationship is just really huge. But then again, you know, you can have babies that got cow's milk and they did great and have a great relationship with their mom. So I feel like there's a balance in it, in that it really is just what that individual mother and baby can do. Because I'm a pediatrician, I always like talking more about after they're born. So even my knowledge in prenatal care is more books and then once they're born, then I get kind of giddy and excited and more invested in their development. So I would say in my practice, the biggest thing I've seen is, again, the relationship, the social relationship. So I used to work, or I went on a mission trip in an orphanage, and it was called Hogar de Materno, and it was for children who hadn't had mothers, and their social development at 6 months, they couldn't sit. So normal child can sit at 6 months. This baby was about 16 months, couldn't sit, very malnutrition, but was getting food, but there was no mother there and there was no love. So early on, we see that even with our kids that are older, they're not speaking well, and usually, not always, but you find out parents haven't been reading, parents haven't been spending that time. So I don't think we can even put a value on parents who are putting in time with their kids, and I think the fruit of that is just huge. Just simple hugs, kisses, and reading. Well, it's a difficult age group because they're usually healthy, and so they've also been out of the practice of getting their yearly physical exams. I think if we would just put more education, you know, those people are maybe in high school or college, so we could address when they come for their physical, let's say if they're having menstruation problems, or if we are getting them to get like their annual pap smears, addressing some of those issues at that time. So maximizing the time that we see these children, because a lot of times if once they're at the age that they can start having babies, really as pediatricians we should have parents step out, address what we call a heads exam. So I talk about the home, education, any kind of drug abuse, alcohol, and then also their social and how they're doing, and if they ever want to hurt themselves or hurt others. So and it's amazing how much I get by doing that screen. So something I thought for my own practice is start adding, you know, have you thought about what you would do if you got pregnant? And then just take 1 minute to address that. Kind of the same thing as the whole idea of prenatal care, addressing it before it happens so that they're prepared and they also know what they even need to do. So I think, and then just restating also with our mothers how important, so that they're teaching their daughters to come in and help their children to have the best care. You know, that one is so hard for me. So there's this vaccine called Gardasil. So they have to get this 3 series, and when they start recommending they get it, they are not even 13 yet. A lot of times they'll start getting their vaccine and they're like 10, and parents will ask me my advice. Well, should we give our children this vaccine? So it's kind of it's a hard one to regulate and say like this is what we should be addressing, although only because it is so personal. And if you're thinking, well, what time do I really talk to my kids about sex ed or about you know, all of those kind of cervical cancer, even if they're not sexually active. But if they are in high school and they were at an old enough age, I would say, yeah, why not talk about it before and get them to start thinking about what it means to be a mom. even some of those classes, they'll have the baby and they're crying and they have to carry it around just to kind of see what it would actually be like, because I think, especially if you have maternal instincts, you think having a baby seems so wonderful. So yeah, I would say that would be a good idea to start addressing it early on when they're in that high school age and they're starting to think of if they are going to have sex or if they're going to have a baby and what that might mean.
Why not educate women or young girls? Because eventually most of them will have babies. And so whether it's we'll need that information in the next year or 10 years, I think it's important.
I do too.
Because I don't think I was ever given information until the day I found out, and I was on Baby Center and looking up what I needed to do.
Right.
So,
you know, another thing is we could have like community-free classes that would offer just education, because even in med school, I had no education on it. You know, so a lot of it has just been experience, but you're in the role of giving advice, and yet there was no class. Same for even nutrition, really. We never had a nutrition class. So some of these things that, you know, are so important. So even just in our community, how fun would that be too? All these moms coming together, giving ideas, how to, you know, just be better moms.